Hey everyone, ready for a deep dive into something that affects us all? We're going to be talking about the way healthcare professionals interact with their patients and how those interactions can really make or break someone's journey when they're trying to manage a chronic illness.
It is interesting, how we often focus on the medical treatments themselves,
Yeah.
but the communication piece sometimes gets overlooked, and that can make a huge difference.
For sure. And what's really cool is that we have some fresh research to kind of guide us on this journey. It was published in Advances in Health Sciences Education in January 2025. And get this, researchers have identified 5 distinct ways that healthcare professionals interact with their patients.
Think of it like this. It's not just good or bad communication, right? It's more like a spectrum of different styles.
Mhm.
And even subtle differences can really have a big impact on how patients feel.
Okay, I'm intrigued. Let's unpack all of this. So first things first. Chronic diseases, they're a big deal, right? They impact your quality of life, they strain our healthcare systems, the whole 9 yards.
Absolutely. And this study, it really drives home how important self-management is for anyone who's dealing with a chronic condition. It's a lot to handle,
Huh?
medications, lifestyle changes, the emotional and social aspects. It can get really overwhelming.
Right. It's a lot,
Mm.
which is why having supportive healthcare professionals is so important. But here's the catch, and the study points this out. A lot of healthcare professionals struggle with effectively helping their patients with that self-management journey.
It makes you wonder, why is there this gap between what patients need and what some healthcare professionals are providing? And the study suggests that maybe it comes down to how these skills are taught, even during their education. It's like a missing piece of the puzzle.
And this is where it gets really fascinating. The researchers, they use something called self-determination theory, SDT, to kind of analyze all of these interactions. Have you heard of SDT?
Imagine it like this. We all want to feel in control of our lives, confident in our abilities, and connected to others.
Right.
That's what SDT is all about. And when you apply that to healthcare, you can see how those interactions can either boost or completely drain a patient's motivation and well-being.
Oh, that is a great way to explain that. It makes total sense. So how does this all connect to those 5 interaction profiles we mentioned earlier?
Well, so SDT highlights 3 basic psychological needs. We've got autonomy, competence, and relatedness. Autonomy is about feeling empowered to make choices. Competence is that feeling of being capable of handling the situation. And relatedness is that feeling of connection and being understood by others. Think about it like in your own experiences. Don't you feel your best when all those needs are met?
100%. So how do these needs tie into how a doctor or a nurse interacts with you as a patient?
Each of the communication styles, they affect those 3 needs differently. So for example, let's take autonomy supportive communication. This style is all about giving patients choices, involving them in decisions, and using language that's inviting rather than demanding. It's more like a collaboration, not a dictatorship.
Yeah, I see what you mean. It helps the patient feel like they're still in the driver's seat, even when they're dealing with a tough health situation.
Exactly. Then you have the structuring style, and this one focuses on providing clear information, guidance, and feedback to help patients feel competent and confident about managing their condition.
Like a coach, like giving you the tools and the knowledge you need to succeed.
A perfect analogy. But then on the flip side, you've got the controlling style. This one, it pressures patients, doesn't really consider their perspective, and it can make them feel obligated to follow the healthcare professional's instructions, even if they're not totally on board.
That doesn't sound very supportive or motivating at all. In fact, I can see how that would make someone feel even more stressed.
And you're right, it can totally backfire,
Maybe.
often leading to patients feeling frustrated and less engaged in their own care.
Okay. And we can't forget about that chaotic style. What does that one look like?
Ah, yes, this one is, it's all over the place, inconsistent, unpredictable. The healthcare professional, they might be scattered, leaving you feeling confused and unsure of what to expect or what steps to take next.
Gotcha. So are these 5 profiles each based on one of those 4 styles, or is it more complex than that?
That's where it gets even more intriguing. These 5 profiles are actually combinations of those 4 interaction styles, not just one dominant style.
Wow, that makes a lot more sense. Okay, I'm on the edge of my seat. Tell me more. What are these 5 profiles all about?
Okay, so the first one is called the motivating profile. Pretty straightforward. High on autonomy support and structure, low on control and chaos. They kind of strike that perfect balance between empowering patients and giving them the clear guidance they need. This is what we consider the ideal profile.
Makes sense that that would be the gold standard. What's next?
The next one is called the active profile. Now, these healthcare professionals, they score high on all four interaction styles, except for chaos, which is average.
Interesting. So they're really trying to be helpful, but they might slip into that controlling behavior from time to time because enthusiasm with a side of my way or the highway, maybe.
Exactly. But hold on tight, because here comes the most common one. It's the undifferentiated profile. And this group scores average on all four styles. So they're not actively harmful, but they're not exactly lighting the way for good self-management support either.
So they're kind of just there. Not exactly inspiring, are they?
It's actually kind of concerning because this profile makes up the largest group in the study. A whopping 29% of the healthcare professionals means a big chunk of them are in this kind of neutral zone. They're not pushing patients forward, but they're not holding them back either.
Yeah, I can see how that would be a problem in the long run. Okay.
Yeah.
What about the other two profiles?
We've got the demotivating profile, which is basically the opposite of the motivating profile. Average on autonomy, support, and structure, but high on both control and chaos. Definitely not the kind of interaction you want when you're feeling vulnerable.
Yikes. Definitely not who I'd want to see when I'm already struggling to manage a chronic condition.
And lastly, we have the inactive profile. And these folks, they're low on the motivating styles and low on control, but relatively high on chaos. So they're similar to the demotivating profile, but more hands-off. They basically leave you to figure things out on your own.
So, not a great approach either. It's interesting that the undifferentiated profile was the most common. That's a little alarming, isn't it? Makes you wonder how many people are out there not getting the support they need.
It really does. And it highlights how important it is for us to focus on developing those positive interaction styles, especially during training. Think about it. If we could shift more healthcare professionals towards that motivating profile, imagine the impact that could have on patients' lives.
Totally. Now, before we get into the specifics of each profile, let's talk about some other cool things they discovered in this study. They looked at differences in these profiles based on gender and profession, right?
They did. They actually found fewer men in the motivating profile and more the demotivating profile compared to the overall distribution.
So does that mean men are just worse at supporting patients' autonomy? Is that what they're saying?
Well, let's not jump to conclusions. The study doesn't really give us a clear-cut answer as to why these differences exist. It could be related to ingrained communication styles, societal expectations, or even how different healthcare training programs emphasize certain approaches.
Right. It's always more complex than just pointing fingers. What about the differences they found based on profession?
Well, they found that nurses were underrepresented in the active profile compared to the overall distribution. Again, it's hard to say for sure what's driving that. Maybe it has something to do with their training or the specific demands of their roles within the healthcare system.
Okay, so we've got these 5 profiles and some interesting differences popping up between genders and professions. What else did the researchers find?
This is where it gets really into the nitty-gritty. They also looked at healthcare professionals' beliefs about self-determination theory and their self-efficacy in providing self-management support.
Makes total sense. You can't really implement what you don't believe in or feel equipped to do, can you?
Exactly. And the findings were pretty consistent with what we've been talking about. Those who were in the motivating and active profiles, they had stronger beliefs in SDT's effectiveness and felt more confident in their abilities to support self-management compared to those in the less favorable profiles.
So it's kind of like a self-fulfilling prophecy. If you believe in the importance of patient autonomy and feel confident in your skills, you're more likely to interact in a way that supports those needs. And that, in turn, leads to better outcomes for the patient.
That's it. And this highlights a key takeaway for training programs. It's not enough to just teach the technical stuff. You also need to cultivate those beliefs and build confidence in those motivating approaches.
All right, before we get too far ahead of ourselves, let's take a closer look at each of those 5 profiles. I want to make sure we really get what sets them apart and how they might play out in a real healthcare setting. Ready to break them down?
I'm with you. Let's start with the star of the show, the motivating profile. Imagine you're interacting with a healthcare professional who really embodies this style. What are some things that would stand out to you? What would that experience feel like?
Well, first off, I think they would actually listen to me, like really listen and make me feel like my perspective matters. It wouldn't be a lecture or them telling me what to do. They'd involve me in making decisions about my own care.
Spot on.
Yeah.
They would also be really good at offering choices in a way that feels empowering, not overwhelming. So instead of saying, you need to start exercising, they might say, what are some activities you enjoy that could help you get moving?
Oh, I like that example. That makes a big difference. They'd also be super organized and clear when explaining things, making sure I have the information and tools I need to feel confident managing my condition.
They'd be pros at providing positive feedback that reinforces your efforts, even when you hit a bump in the road. They get that managing a chronic condition is a journey, not a sprint.
Okay. Okay, so we've painted a pretty clear picture of the motivating profile. Let's flip the script and talk about the demotivating profile. What kind of red flags would you be on the lookout for if you were interacting with a healthcare professional who falls into this category? What would make your alarm bells go off?
Well, this is where you'd start to feel that pressure, like you're being dismissed or even manipulated. They might downplay your concerns or push their own agenda, leaving you feeling like your input doesn't really matter, like you're not being heard.
And I bet they wouldn't be very good at explaining things clearly either. You'd leave the appointment feeling more confused than when you walked in.
Exactly. And because of their chaotic nature, you'd never know what to expect from one visit to the next. They might be completely hands-off one day and then overly critical the next. That kind of inconsistency really undermines trust and motivation.
Yeah, I can see how that would make it hard to stay engaged in your own care. It's almost like they're setting you up for failure.
That's a powerful way to put it. And it really underscores the importance of recognizing those less helpful styles and seeking out healthcare professionals who align with our needs.
Okay. We've covered the motivating and demotivating profiles, but what about the ones in the middle? What about that active profile, high on everything except chaos? How would that play out in their interactions?
These are the healthcare professionals who are truly passionate about their patients' well-being. They're full of energy and genuinely want to help. And that really comes through in their high levels of autonomy, support, and structure. But their enthusiasm might sometimes lead to that controlling behavior as they try to make sure their patients are following the treatment plan.
So they mean well, but they might need to dial back the control a bit to really empower their patients.
Exactly. It's almost like they're so eager to help that they accidentally take over, which can actually hinder a patient's progress in the long run.
All right, let's move on to the undifferentiated profile. This one seems a bit trickier to pin down since they're average across the board. How would you describe their typical interaction style?
This is where you might feel like, well, they're not doing any harm, but they're not really doing much good either. They might provide basic information and go through the motions, but there's no genuine engagement or personalization. It's like they're going through a checklist.
So they're not a bad apple, but they're not the cream of the crop either. More like a bland, unripe one.
You could say that. It's a pretty accurate analogy. They're not going to make you sick, but they're not going to nourish you either.
Makes you think about all the unripe interactions out there. Okay, and last but not least, we have the inactive profile. Low on motivating styles and control, but high on chaos. What kind of vibe would they give off in a healthcare setting?
This is where you'd likely feel a sense of abandonment, almost like you're being neglected. They might be physically present in the room, but they're not truly present in the interaction. They offer very little guidance or support, leaving you to navigate the complexities of your condition all on your own.
It's almost like they've checked out, just going through the motions without any real investment in your well-being.
Exactly. And that can be incredibly discouraging when you're already struggling with a chronic illness and really need someone in your corner.
Okay, so we've got these distinct pictures of the 5 profiles. Let's bring this back to you for a second. Why should you care about all of this? What's the big takeaway here?
That's a great question. I think the main takeaway is that healthcare isn't a one-size-fits-all approach. And as patients, we have a right to expect a certain level of communication and support from our healthcare professionals.
Especially when we're dealing with chronic conditions that need constant attention and a strong sense of self-efficacy to manage it all. It's like being your own health advocate every single day.
Couldn't agree more. And understanding these interaction styles can help us be more aware of what's happening during our appointments. It can empower us to speak up for ourselves and seek out healthcare professionals who really get us and our needs.
You're right. It's about finding that good fit. If you're someone who thrives on clear structure and guidance, you'd probably do well with someone who leans toward the structuring style.
That makes sense. But if you're someone who values their autonomy and wants to be involved in making decisions, you'd probably be happier with a healthcare professional who really embodies that autonomy supportive style. It's about finding someone who matches your approach to your health.
This makes me think back to my own experiences with healthcare professionals. I've definitely met a few who I'd categorize as that demotivating profile. And looking back, it's no wonder I felt so discouraged. And just not into managing my own care.
It's so common to feel that way. And remember, you're not alone. The fact that the researchers found such a variety of interaction profiles, including those less helpful ones, it suggests that this is an issue throughout the healthcare system.
Which leads to the big question, what can we do about it? How do we get more of those motivating and active profiles out there?
Well, the study highlights the need to bring self-determination theory into healthcare education. If we teach future healthcare professionals about the power of autonomy support, competence, and relatedness, we can give them the tools and mindset to have more empowering interactions with their patients.
And it's not just about teaching the theory, it's about practice and feedback, right? Like having them role play different scenarios and getting guidance from experienced mentors.
Exactly. And I think we also need to address those things within the system that contribute to these less desirable interaction styles. Things like time constraints, crazy workloads, and a focus on efficiency over patient-centered care.
It's true. If healthcare professionals are burned out and feeling the pressure, they're less likely to have the mental and emotional space for those supportive interactions.
It's like trying to run a marathon on an empty stomach. You need to support the healthcare providers so they can effectively support their patients. It's a two-way street.
Couldn't have said it better myself. This topic is so fascinating, and there's so much to consider. It's not just communication, it's about power dynamics, empathy, and building a healthcare system that prioritizes the well-being of everyone involved. But let's get back to the study for a second. We've talked a lot about the implications for healthcare professionals, but what are the takeaways for you, the patient? What can you take away from all of this?
One of the most important things you can take away from this research is the power of self-advocacy. By understanding these interaction styles, we can recognize which ones work for us and which ones leave us feeling drained and defeated.
And if you're not getting the support you need, you have the right to speak up and ask for it. You can say things like, I want to be more involved in making decisions about my care. Or, can you explain that in a way that's easier for me to understand? It's your health. You have a voice.
Yes, and if you feel like your concerns are being ignored or you're not comfortable with your healthcare provider, remember you have the right to get a second opinion or find someone who's a better fit. Your health and well-being are worth advocating for.
Speaking of advocating for ourselves, the study mentioned how a healthcare professional's own beliefs and self-efficacy can influence how they interact with their patients. Do you think there's anything we as patients can do to encourage those positive beliefs and boost their sense of self-efficacy?
That's a thought-provoking question. It's not something the study directly addresses, but I think there's definitely potential there. Even something as simple as thanking a healthcare professional for exhibiting those motivating qualities can make a difference. It can reinforce their belief that this approach is valuable, and it works.
You're right. A little positive reinforcement can go a long way, even for healthcare professionals. We all need encouragement.
Exactly. And being an active and engaged participant in your own care can also help. When you're willing to learn, ask questions, and really take ownership of your health journey, it can be really motivating for the healthcare provider, too. It's like you're in it together, working towards the same goal.
This has been such an eye-opening deep dive. But before we wrap up, I'm curious to hear your thoughts on one last question. Think about this. If you were dealing with a chronic illness, which of these 5 interaction styles would be most helpful to you? What would you be looking for in your healthcare provider?
That's a great question to reflect on. There's no right or wrong answer. It really comes down to your individual needs and preferences. But I think the more we understand about these different styles, the better we'll be able to choose the right healthcare providers for us and advocate for the kind of support that truly empowers us on our health journeys.
Well said. And we always encourage you to keep exploring this topic and share your thoughts and experiences. We're all in this together. Now let's shift gears a bit. We've been talking a lot about these interaction styles in a general sense, but I think it's helpful to break down each profile even further. Let's start with that motivating profile. What are some specific behaviors or phrases you might notice if you're interacting with a healthcare professional who embodies this style? What would those conversations sound like?
Great question. With the motivating profile, you definitely feel a sense of respect and collaboration. They'd likely start by asking open-ended questions to understand your perspective, your goals, and any challenges you're facing. They wouldn't just jump into giving advice or instructions. It would be more about exploring your needs and working together to create a plan that feels right for you.
So instead of saying, you need to lose weight, they might say something like, what are your thoughts on making some changes to your diet and exercise routine? It's more about understanding your motivations and barriers.
Exactly. They would also be really good at highlighting your strengths and accomplishments, no matter how small they might seem. It's all about building that sense of self-efficacy so you feel capable of managing your condition. They'd be your cheerleader, in a way.
And I bet they'd be skilled at providing information in a way that's clear and easy to understand, right? No confusing medical jargon or overwhelming data dumps.
Absolutely. They'd be able to break down complex concepts into bite-sized pieces, using visuals or analogies to make things easier to grasp. They'd also be patient and willing to answer all your questions, no matter how basic they might seem. They get that everyone learns differently.
Okay. So we're getting a good feel for the motivating profile. Now let's contrast that with the demotivating profile. What kind of language or behaviors would be red flags in this case?
Well, with the demotivating profile, you'd likely feel a sense of pressure and judgment. They might use guilt trips or scare tactics to try and get you to comply with their recommendations. They might say things like, if you don't start taking your medication regularly, you're going to end up in the hospital.
Ugh, that's awful. I can definitely see how that would make someone feel even less motivated to take care of themselves. It's like they're adding fuel to the fire.
Exactly. They might also be dismissive of your concerns or interrupt you frequently, making you feel like your voice isn't being heard. It can be a very invalidating experience.
And I bet they wouldn't be very good at explaining things in a way that makes sense. You'd probably leave the appointment feeling more confused and frustrated than when you walked in.
That's right. And because they tend to be more chaotic in their communication style, you might never know what to expect from one visit to the next. One day they might be super critical and judgmental, and the next day they might be completely hands-off and disengaged. It's that inconsistency that can really chip away at your trust and motivation.
Okay. So we've covered the two extremes, the motivating superhero and the demotivating villain. Now let's talk about those middle ground profiles. How would you describe the interaction style of someone who falls into the active profile? Remember, they score high on everything except chaos.
The active profile is an interesting one. These healthcare providers are definitely well-intentioned and enthusiastic about helping their patients. They're often very knowledgeable and eager to share their expertise. However, their high scores on both autonomy support and control, it can create a bit of a paradox.
So it's like they want you to feel empowered, but they also have a strong opinion about how you should manage your condition.
Exactly. You might get mixed messages from them. They might start by asking about your goals and preferences, but then quickly jump into giving you very specific instructions or recommendations without leaving much room for negotiation.
So it's like they're trying to strike a balance, but they might unintentionally slip into that controlling behavior.
Precisely. They might have the best intentions, but their enthusiasm can sometimes overshadow your needs and preferences.
Yeah.
It's like they're so focused on getting you to the finish line that they forget you need to be in the driver's seat.
All right, let's shift our focus to the undifferentiated profile. These folks are average across all four styles. So how would their interactions typically play out?
Imagine a healthcare professional who goes through the motions, ticking boxes, following protocols, but doesn't really connect with you on a personal level. That's the undifferentiated profile in a nutshell. They might provide the basic information and answer your questions, but there's a lack of genuine engagement or personalized attention.
So they're not necessarily doing anything wrong, but they're not exactly going above and beyond either.
Exactly. You might leave the appointment feeling like you got the basic care, but, there's no real spark, no sense of being truly seen or heard. It can feel a bit impersonal and transactional.
And lastly, let's talk about the inactive profile. These healthcare providers are low on motivating styles and control, but high on chaos. What would that look like in a real-world setting?
Imagine a doctor who seems distracted or disinterested during your appointment. They might not remember your medical history, or they might give you conflicting information from one visit to the next. That's the hallmark of the inactive profile, a lack of consistency and follow-through.
It's almost like they're not really invested in your care. You're left feeling confused, unsupported, and unsure of what steps to take next.
Exactly. And that can be really disheartening, especially if you're dealing with a complex, chronic condition that requires ongoing management and support. It's like being set adrift without a compass or a map.
This breakdown of the profiles has been so helpful. It really brings those abstract concepts to life. But now I'm curious. The study focused on healthcare professionals in training. What about those who are already out there practicing? Do you think these interaction styles hold true across the board?
That's a great question. While this particular study focused on healthcare professionals in training, I think it's safe to say that these interaction styles likely exist across the spectrum of healthcare experience. Think about it. We've all encountered different types of doctors, nurses, therapists, etc. throughout our lives. And some have probably resonated with us more than others.
So even though this research focused on those early in their careers, it gives us a valuable framework for understanding the different ways healthcare professionals communicate and interact with their patients. And that awareness can empower us to advocate for the kind of care that best meets our needs.
Absolutely. And I think it's important to remember that these interaction styles aren't set in stone. People can change and evolve, especially with the right training and support.
That's a hopeful thought. So, what can we as patients do to encourage more healthcare professionals to embrace those motivating and active styles?
That's a great question to ponder. First and foremost, be upfront and honest with your healthcare providers about your needs and preferences. Don't be afraid to say, I'm someone who likes to have all the information before making a decision, or I really value your guidance and support to stay on track with my treatment plan. It's about setting the stage for a collaborative relationship.
That makes a lot of sense. It's like giving them a roadmap to your communication style.
Exactly. And what about those times when you might feel intimidated or hesitant to speak up? Especially if you're dealing with a healthcare provider who seems to have that controlling style.
Right.
It can be tough to assert yourself in those situations.
I've been there. It's like you want to advocate for yourself, but you also don't want to offend them or jeopardize the relationship.
I hear you. It's a delicate balance. But remember, you have the right to be heard and respected. If a healthcare provider consistently dismisses your concerns or makes you feel uncomfortable, you might want to consider finding someone who's a better fit.
It's empowering to remember that we have choices when it comes to our healthcare. Okay, so we've talked about being honest about our needs and not being afraid to speak up. What else can we do to be active participants in our own care?
Don't underestimate the power of asking questions. Don't be afraid to ask for clarification if something is unclear, or to ask for more information about your treatment options. The more informed you are, the more confident you'll feel making decisions that align with your values and goals.
Asking questions shows that you're engaged and invested in your health. Plus, it gives the healthcare provider valuable insights into your thought process and priorities.
Exactly. It fosters that two-way communication that's so essential for a strong patient-provider relationship. And lastly, be proactive in managing your condition. Keep track of your symptoms, follow your treatment plan as best you can, and don't hesitate to reach out to your healthcare professional if you're struggling or have questions.
I love that. It shifts the dynamic from passive recipient of care to active collaborator.
Exactly. When you demonstrate a commitment to your health, it often inspires your healthcare provider to meet you halfway. It's like you're both working together toward the same goal.
This has been such an insightful deep dive into the nuances of patient-provider communication. But before we wrap up, I want to leave you with one final thought to ponder. Think back to your own experiences with healthcare professionals. Have you encountered any of these interaction styles? How did they impact your motivation and ability to manage your health? What kind of interaction style do you think would be most beneficial for you going forward?
Those are great questions to reflect on. It's all about understanding yourself, your needs, and what you value in a healthcare provider. Armed with that knowledge, you can be a more empowered advocate for your own well-being.
Beautifully said. We encourage you to continue exploring this topic and to have open conversations with your healthcare providers about what matters most to you. Remember, you deserve to feel heard, respected, and supported on your health journey.
It's been a pleasure diving deep with you.
Likewise. Until next time, stay curious, stay informed, and keep advocating for your health.